Welcome to the Refugee Community Partnership Health Information video series. In today's video, we'll be talking about mental health conditions, depression, and anxiety. Depression is a very common medical illness that can negatively change how you feel, think, or act. It is different from normal sadness. It can make you feel deep sadness or lose interest in things you used to enjoy doing before. Depressed people feel down most of the time for at least 2 weeks. They also have at least one of these two symptoms. They no longer enjoy or care about doing the things that they used to like to do, or they feel sad, down, hopeless, or cranky most of the day, almost every day. Depression can cause you to lose weight or gain weight, sleep too much or too little, feel tired or like you have no energy. It can also make you feel guilty or like you are worth nothing. Or it can cause you to forget things, feel confused, or move and speak more slowly than usual. It can also cause you to act reckless or have trouble staying still. Depression may also lead to thoughts of death or suicide. If you think you might be depressed, please see your doctor or nurse. Only someone trained in mental health can tell for sure if you are depressed. You may be wondering what causes depression. There is no one single cause that leads to depression. We know certain factors can increase your risk of developing this illness. Some common factors are if there's a family history of depression, or if you experience stressful events either as a child or as an adult. We also know some medical diseases, medications, and substance misuse, including too much alcohol, can increase your chance of developing depression. When someone is depressed, we know that it causes a chemical imbalance in their brain. The good news is, no matter the exact cause of your depression, we have excellent treatments available that we will discuss later in the video. Can depression become a health emergency? Yes. If you ever feel like hurting or making plans to hurt yourself or someone else, do one of these things right away. Call your doctor or nurse and tell them it is urgent. If you speak limited English, have a family member or close neighbor who speaks English call on your behalf. Tell them to request an interpreter so you can personally tell your doctor's office the reason for the call. Or you can walk into the clinic and tell them even though you don't have an appointment. You need help right away. You can also call for an ambulance. In the US and Canada, dial 911. You can also go to the emergency room at your local hospital. You can also call the National Suicide Prevention Lifeline at 1-800-273-8255. What are the treatments for depression? People who have depression can get one or more of the following treatments in their doctor's office. The first being medicines that relieve depression. The second being talk therapy with a counselor. As we said at the beginning of the video, when someone is depressed, their thinking, emotions, and behaviors are negatively changed. Counselors are mental health experts. They can help you identify the changes in your thinking, feeling, and behavior patterns, and teach you ways to reshape those. They can also teach you certain relaxation and meditation techniques, which, if done regularly, can be helpful. Third, physical activity is another way to manage depression. Regular exercise can improve mood, depression, and anxiety. It also reduces the risk of heart disease, diabetes, and improved sleep. While there are many exercises and activities to choose from, talk to your doctor to find out how much exercise you should do given your specific health conditions. Lastly, healthy food and restful regular sleep can also help you with depression. You and your doctor will need to work together to choose a treatment for you. People with depression that is not too severe can get better by taking medicines or doing talk therapy with a counselor. People with severe depression usually need medications to get better and might also need to see a counselor. Medicines might work a little faster than counseling, but medicines can also cause side effects. If you experience any side effects, please talk to your doctor honestly about those side effects. They can adjust the medication or choose another one without those side effects. Sometimes it can take multiple tries before finding the right medicine for you. On the other hand, seeing a counselor involves talking about your feelings with a stranger. That is hard for some people. Just like medicine, it can take multiple tries before finding the right counselor for you. Some people refer a counselor who has the same gender or cultural background. Talk to your doctor to see if they can find you another therapist according to your preference. Both treatment options take a little while to start working. Many people who take medications start to feel better within 2 weeks, but it might be 4 to 8 weeks before the medication has its full effect. Many people who see a counselor start to feel better within a few weeks, but it might take 8 to 10 weeks to get the most significant benefit. If the first treatment you try does not help you, tell your doctor or nurse, but do not give up. Some people need to try different treatments or combinations of treatments before they find an approach that works. Your doctor, nurse, or counselor can work with you to find the right treatment for you. Also, please continue to see your doctor and follow their treatment advice closely even when you start to feel better. It is important to know that children can also develop depression. But the symptoms of depression are a little different in children and teenagers than they are in adults. Teenagers who are depressed often seem more irrational than usual. They get quickly annoyed or bothered. They might even pick fights with people. If you are worried about any recent and sudden changes in your child's behavior and emotions, please make an appointment and talk to their doctor. So what if you take medicine for depression and want to have a baby? While some depression medicine may slightly increase the risk of birth defects, the risk is still very low. More importantly, having untreated depression during pregnancy can cause much worse thoughts or behaviors, preventing you from getting proper prenatal care. If you want to get pregnant, tell your doctor, but do not stop taking your medicines unless advised by your doctor. The two of you can plan the safest way for you to have your baby. It's also important to talk with your doctor if you want to breastfeed after your baby is born. Breastfeeding has lots of benefits for both mother and baby. Some depression medicines are safe and some are not to use while breastfeeding. But having untreated depression after giving birth can also cause problems. So do not stop taking your medications. Your doctor can work with you to plan the safest way for you to feed your baby. Now we will briefly talk about another common mental health disorder called anxiety. To feel anxious is to feel worried or nervous. We all may feel anxious from time to time, which is a normal human reaction. It becomes abnormal when we are incredibly anxious most of the days of a week for more than 6 months. This constant feeling of anxiety can cause difficulty with proper sleep, making you feel tired and have tense muscles, and even make you forgetful. Overall, you may struggle to lead your regular everyday life. Sometimes severe anxiety can present as headaches, chest pain, trouble with breathing, or stomach pain. If you have any of these symptoms, please call your doctor right away. You should call the doctor if you are more anxious than normal, if you are anxious every day, or cannot complete daily tasks because of anxiety. Anxiety and depression can often occur together and may be caused by the same thing. Even if you only experience anxiety, treatments are very similar to depression, like we explained above, including medicine, counseling, physical activity, and other lifestyle changes. If you would like to learn more about this or other health conditions, please visit the Refugee Community Partnership's website at refugeecommunitypartnership.org. Thank you.